Hi everyone, my name is George Semaganda from Macquarie University, Department of Computer Science. Today I'm going to talk about exploratory data analysis for data sets that are around maternal health, and I'll dive straight into the presentation. The first data set is maternal health. It's a CSV file that I got from figshare.com. It has 9 categorical features, and then the main data type is object, and this is a link to the dataset, and then a link to the Collabo notebook that I used for the EDA. This is summary statistics for the dataset for all the 9 categorical features. When I go to data cleaning, there were no missing values for all the 9 categorical features. And then, yes, I look at the distribution of the mother's age during childbirth. That was that were 2 categories. That is the adolescent, and then the adults being with the highest count during the time of childbirth. Then the antenatal care checker, where we have 3 categories of the general practitioner, the obstetrician, and then the midwife with the highest count. Then the distribution of the place of antenatal care, which was basically of 4 categories: the clinic, the healthcare center, the hospital, and then the village maternity hut as fourth. Then look at the danger signs of pregnancy. Basically, there was a sign or no sign of danger during pregnancy. So basically, no signs of danger at the highest count, and then the signs at the lowest count. Then the iron tablet consumption. There was a statistic for the mothers who consumed, and then the ones who did consume with the lowest count. Then the distribution of birth attendants. Yes, the general practitioners were less than 10, and then the midwives were the most, more than 50. Then the places of birth for these mothers, there were 4 categories: the clinics, the health centers, the maternity hut, and then the homes. So basically, the clinics and healthcare centers had the highest counts. Then the type of delivery for these mothers, there was normal delivery with the highest count, and then section without planning with the lowest count. So section with planning had without planning, sorry, was more than the section with planning. And then I went ahead and looked at some cases where this data set could be applied, could be used. Then amongst others is maternal health studies, resource allocations, then educational programs, and the policy making. So I'll dive straight into the second data set, that is maternal health risk, with which I got from github.com. It's a repo. It had 6 categorical features. The data type was both numeric and object. Then still I have a link to both the data set and then the collab notebook for the EDA. Then these are basically summary of the statistics for the data set. Then yeah, there was also no data cleaning because most of the features had valid values. Then look at here. It is a representation of distribution of age, which is kind of skewed because from 10 to 40, we see the most count, and so the median of our data is going to fall within. So that means the most of the count, the age bracket was less than 40, and then we had some outlier which came up to 70 here, if you can see, and that's how we have data that is skewed. Then the distribution of the systolic blood pressure. Remember, normal blood pressure is always between 190 and 140. So basically, it's kind of a bell-shaped, which comes out to be a normal distribution a little bit. Then when we look at the distribution of diastolic blood pressure, yes, remember the diastolic blood pressure is also between 70 and 90 normally. So that's why you have most of the values between around here, and then a median of 80 if you look at the box plot here. Then the blood sugar distribution, blood sugar is basically between 7 and 15 normal blood sugar. So that's why the highest count is around 6 and 8. And then we have these outliers here, uh, since we are dealing with different ages of people for this data set. Then the no, the body temperature, remember body temperature is normally between 98 there and less than 100, except for the few outliers that came in. Maybe so by the time of the data collection, some of the respondents had fever. That's how we come up to 103 for some of these respondents. Then the heart rate, normal heart rate is between 70 and 80 BPM. So that's why we have the count, most of the count here between 60 and 80 for the heart rate. Then the risk levels for this type of for this data set looked at three categories of risk levels: the high, low, and mid risk. And from the data set, it shows that all these patients had risks. They had risks to at least to any of the features they were trying to study. So here is a correlation heat map. It is basically showing correlation between two categorical features, and one represents a positive correlation between the given features, and then negative one represents a negative correlation between the given features, and then zero represents no correlation between the features. If you look straight now, for example, at 0.08, which is age and heart rate, so there is no correlation between the two categorical features. Then this is a pair plot from the findings, and then the use cases I looked at: maternal health monitoring, medical research, risk assessment, and preventive health care of how this dataset could be used. Then I'll dive straight to the next dataset, that is digital. It's indicators, health indicators for Uganda from World Bank. I got it from data.humandata.org, and then it had 16 categorical features, then both numeric and object, and the links to both the collab and the link. So the statistics are here for the data, and yes, this data had some missing values, and of course it required a little bit of cleaning and processing. Then basically we shall look at the visualizations. This is visualizations for the year versus birth attended by skilled health. It is shown clearly that it is a gradual increase between the year 1990 and 2015. There has been a gradual increase in the number of births attended to by skilled labor. Then year versus current expenditure, EDA. Yes, health expenditure. So as years increase, there is a decrease in the health expenditure. According to this data, there was decrease between 2000 and 2014. Then this is a health expenditure per capita, and yeah, health expenditure has been increasing with years, with increasing years since 2000 and 2014. So if we continue straight, this is a scatter plot still for year versus GDP, which is also a gradual increment. Then year versus hospital beds, which is gradual decrease. The vacant hospital beds in the hospitals. So that means there was an increase in the people, in the mothers who go to hospital beds, who now go to hospitals when they are giving birth. Then year versus life expectancy after birth for females, which is also a gradual increment from 1960 to 2010. Still a gradual increment for men. Then I'll talk about this, which is, yeah, again, it's lifetime risk of maternal death. So we see that from these statistics, between 1990 and 2015, there has been a gradual decrement as for maternal death. So there is increased maternal health than as time goes on. Basically, that is it. And this is just normal distribution for staff, normal distribution. And then scatter plots attended to by health skilled staff. Yes. So basically, it shows that there has been improvement in the life expectancy from birth, and then for both females and males, then uh, there has been a reduction in the lifetime risks when it comes to maternal death. If you project, that okay, the birth that attended by skilled, by skilled staff, and then there has been decrement in the risk of maternal death due to that. Then this is a sister company. Then I'll move straight into expected birth for fuel. Then the life expectancy at birth for females, which is also a gradual increment as years increase. Then look at the expectancy at birth. Then for females versus the GDP. So there has been an increment for the expectancy, and then the GDP. Between that, then nurses and midwives. So here, I'll just look at the correlation heat map that is basically stressing all the categorical features and try to compare. So our one still represents a high correlation, positive correlation between given features, between the two given features, and then the blue represents a, a, a relative correlation. It can either be negative or less than 1, and then white, which is 0, represents no correlation between the two given categorical features. So I looked at some of the use cases which we can apply for this data set. It could be applied in resource allocation, maternal health programs, healthcare allocations, then monitoring and evaluation. I'll dive straight into the next data set. That's maternal and reproductive health indicators. It's a CSV5. It's also from data.humdata.org. It had 33 categorical features, then both numeric and object with the links to both the data set and then the collab notebook. Then this is basically a summary of statistics. It also had missing values, so we had to do some cleaning for some of these missing values and pre-processing. So this is distribution. Remember, from this data, looking at an indicator, they were looking at an indicator, then an indicator, for example, they establish its rate, and then the region, the country from this data set. Now, this has been I need to go back to this slide for the indicator. Okay, they get an indicator, then they give a code to a given indicator. For example, maybe the abortion rate within a given age bracket of women, and then they get a display basically for that indicator. For example, here there is proportion of women aged between 20 and 24 years of age who were married by age of 15, the percentage. Then this one is the unintended pregnancy rate model. So basically, this is the display to a given indicator and how they are. And then this is basically a URL to a given indicator. Then the published state, maybe the state through which this indicator is being collected, then the published display, and then the distribution year. So we may get a range of period for which we are studying the indicator for this type of data set. Then the distribution of year display, and then the distribution of the region. So here they are just looking at the region. Maybe the region is Africa or central Uganda, Western Uganda, and then they give a detailed description for that. Then here is just the country code. Then the statistics have to be from a specific country, and then the start year when the statistics began, and then the end year when the collection of the statistics ended. So basically, this is it. This is the age group for the target group for the statistics, and then the display of the age group still. So the sex of the target community, maybe if they are targeting females or males, and now the display for that. So the distribution of uncertainty levels, remember, uncertainty levels can either be certain or non-certain, which is here is a is a uniform distribution, and then the displayed values are the values they are using for for their findings. Then the distribution of the numeric values, this was it, and then the heat map correlation between these values. So basically from here, they're showing that there is basically no much correlation between all these features for this type of data set from our EDA. So for example, if you look at sex, has no correlation with the year of the study. There is no correlation at all. So every other feature is independent of each other for this type of data set. And so I went ahead and looked at some of the use cases we could use. Remember, we are establishing general statistics for a given region, about a given number, a given community, about a given target population for a given age bracket from a given location. So basically, if you look at maternal health service planning, in public health research, academic research, monitoring and evaluation. So I'll dive straight into the next data set. Next data set is a pregnancy risk assessment monitoring system with PRAMs. It shows a CSV file from data.world. It had the 6 categorical features, both numeric and object. So the dataset link and the collab link. So this is basically the statistics summary for the categorical features. And then there was no data cleaning required because all the values were valid. We had no missing values. So if I continue further, so this was the distribution of prevalence, or the count for the participants in this statistics analysis. So this is a box plot for the prevalence value, then a scatter plot for prevalence versus year, which is normally distributed, and then a scatter plot for the lower 95% confidence interval that has a gradual increment between the lower and then the prevalence value, the lower confidence interval with the people who are responding to this to this statistics study, and then still the same thing. Also the upper 95% confidence interval is also a gradual increment with increasing number of people who are participating in the study. So the distribution of the lower confidence interval is somehow skewed, as it increases. Then the highest count was realized between 0 and 20, and then yes, that is a box plot. Then this is a scatter plot, and then the lower 95 confidence interval with its prevalence percentage, still it's both 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 are increasing with their ex they are both are are increasing with each other. So there is gradual increment between both features. Then still for upper confidence interval, and then the the 90 between increased their direct proportion, the increased confidence interval and then increased lower confidence interval, they both increase with each other. And this is basically distribution for the confidence interval. And yes, this is it for this data set. And then the distribution of source, remember it came from one source, it was just prompt. And then the distribution of questions, which was uniform distribution amongst all the participants. And then for the statistics study, so this is a correlation heat map with our positive ones representing positive correlation, and then blue, which is kind of representing a negative correlation, and then this brown, which is representing almost no correlation. So the pair plot for all these categorical features, basically, you may find that like for example, basically this is a pair plot for the features. And then the use cases managed to look at for this data set, research and analysis, maternal health care planning, and then public health care planning. So if I continue straight, oh, thank you so much. I'll continue straight from here with my other data sets. I'm still doing EDA on maternal health data sets. And yes, thank you very much.